Doctor, can you see the form?
This is the form. Yes,
This is the
exactly.
form. So if anybody want to ask any question from the points of the form, you can tell, please.
Dr. Usman, is
Yes.
number one written candidate ID number, because I'm appearing for the first time. So because it written, if you do not have a 7-digit candidate
Okay.
number.
So
And
Dr. Jabad, I'm requesting you, can you explain one by one for us?
okay.
For
So first,
example, this is the form and it is maybe newly designed for this November exam. So candidate ID, you can explain one by one, please. I think it will be useful and time saving. Later
okay.
on, any colleague can ask later, right? After telling you, anybody can ask. So please carry on. I'm listening also.
This first point is candidate ID numbers. So if you do not have a 7-digit candidate ID number, a new ID number will be assigned to you and sent to you by email. Please make a note of it and quote in your exam papers and or in all correspondence. Me, I put it that new candidate in the bracket because I don't have candidate
Yes,
ID.
so you don't need it. Those who appeared before or got it, then only they can fill it up.
The one who appeared before or those have it, they can put it here.
Yes, I saw this question also in the group. Maybe those doctors are newer for that they were confused. I think you got the answer now if you are here. So you don't need to put the number there as you are very new applicant. Okay, next point.
Okay. The other is easy. Last name, I mean the second name you have to put
Okay, you understand.
usual forename, the first name, then full name. I mean,
Appear on
if
the
I,
record. Okay,
yes, and then the residential address you can write.
right. Then
Uh,
other contact details mandatory. All are remember that all informations are mandatory other than the ID. Okay, then
the telephone number, and
telephone
then
number, emergency number, email.
WhatsApp number and email. Email should be important because they will reply to you in the
They,
email.
yeah, so they are asking WhatsApp number also, and
WhatsApp.
sometime, doctor, I like to say, we are collecting the WhatsApp number in the Google form sometime. Unfortunately, I don't know. Some colleagues couldn't understand, or it is our deficiency to let you know that how to write the number. Always we are telling that put your the country code. Some doctor didn't put the country code. So it will be wrong for you, doctor, right? So definitely you have to put the country code where you are now there. Okay? Don't do the mistake there. So they are also mentioning, you see, country code, region and other. So don't simply write in Saudi Arabia starting with a 05 or other. Isn't that it?
Right. Thank
Zero
you.
05 maybe Al Jawal or Mobili, whatever. You have to write the plus 966. Then other
Yes,
number.
966. Yes, and the
Yes. Okay.
country. And the
Then
email
7.
and details, dates of all.
My humble suggestion, I don't know, are they telling or not? In my experience, you have to write the email in the capital letter, not in a small letter.
But I,
Otherwise, C will be E.
oh,
C will be E. Okay, remember
but
it.
in small letters because
No, doctor, they did they mention in a small letter?
they didn't
Not
mention anything.
mention. But my technical advice to you: write in the capital letter. Write
Okay.
in the capital letter. Because there will be no difference. Even you write the capital letter in the mail also in the real life, you will see there will be no change. This is not, the email ID is not case sensitive. Whatever the uppercase or lowercase, no problem. So to avoid the technical thing, as you will be writing in the hands, so write in the capital letter. And be careful about the S and the 5. I
Uh,
face the problem. I know about my one. So which will be the 5, which will be the S? Take care of it. Okay. About the 9 and 4. Tricky thing. 9 and 4. Be clear about this. Okay, then go down.
okay. And
7.
dates of part one exams taken previously. So
If
here I wrote.
yes. If PBS is newer, you will let not applicable. Okay. Or
But
not appeared. Is not it?
they can write the
And
dates
not
previous.
applicable or not. If the date, then you want to mention the date. Then education
Then
and training.
yes, a name and location of medical school graduated from. Here you write the medical college and the university.
Yes, university. Okay.
Date of qualification of your MBBS.
So what
Yeah.
will be the qualification? Any
Uh,
confusion over there? Any colleague, doctor, or all of you understood? So I think this is the date of your graduation certificate.
Yes, the date of your graduation
So
MBBS.
look at your MBBS certificate in which day it is signed. That will be the date. And unfortunately, maybe like my country also previously, they have given the certificate many months later. Nowadays, they corrected in the last few years. But initially, after 1 year, they are giving the certificate. So it is disgraceful for you. Be careful about this. Anyway, number 10.
Country of postgraduate clinical experience. Here, I mean, wherever you have worked, like me, I worked Pakistan and Saudi Arabia.
So do you like to add anything here, Dr. Javed? Any technical suggestion?
For country of postgraduate clinical experience,
Yes.
because this is what I understood that the countries you here mentioned into country, so you have to mention about the country.
No, no. Suppose someone asking that possibly Pakistani, Bangladeshi, Indian, or others working in the Saudi Arabia. Okay.
Mhm.
So
Right,
your primary medical qualification in your home country. So country of postgraduate training. Suppose you are doing your MRCP or other degrees, MCPS or whatever else, or even the training there. So how will you write it? Some doctor will submit the 5 year GP practice, right?
right.
Very commonly, maybe from Bangladesh, doctor will be like that. So 5 year experience, is it experience in country, home country, or abroad? It is also question. So if you like to write the training 5 years in Pakistan, so if you mention postgraduate training in Saudi Arabia, it may not match. Okay, Dr. Javed?
I mentioned both actually, Pakistan and Saudi Arabia, so as to cover both.
Okay. No, no, I'm telling that if you want to take the certificate from your colleague for the 5 years from the
Mhm.
same person, but
Mhm.
you work 3 years in Saudi Arabia, it may not match. In
Okay,
that case, you have to take the two separate certificate, one from your country, another from Saudi Arabia.
okay,
Understand my point? I'm actually telling all other colleagues, those who are still connected with us. So take care of this. If you write some training period, it should be matched with your certificate.
okay.
You can submit double certificate, no problem. Okay, if you think
I have
as
given like both. I mean, from Pakistan as well as
yeah.
from Saudi.
For
Both.
example, those who are in a structured training, possibly available in Pakistan better. So in the Pakistan, there are institutional training are there. So you are getting the training 2 year certificate there, maybe another 1 year training in the as a GP. So there may be double certificate. But I don't know how the Royal College are thinking. If it is summarized in one paper, the who is certifying, he will write that this doctor, I know him, he got under this training 2 years and others, and he is doing the GP practice so and so. Okay, will they accept or not? Even then, you need to add the document of training, is not it? For this reason, two paper is still needed. There might be some confusion also. Okay, Dr. Javed,
Okay.
I think you cleared your issues. Those are other colleague. I think they know about that. Now the next point, 11.
A country of ethnic origin. That is, I mean, country of
Is
your
the name of the home country, right?
yes.
Then
Then registration authority where you have registered. But I think here I mentioned about because this registration of Saudi Arabia is temporary and Pakistan was permanent, so I mentioned the only
I
Pakistan.
think so. There some colleague also confused.
So initially got confused. First I
Now,
wrote actually both.
yes, yes.
Then
So this
I
is
thought,
it is a primary registration in your country after graduation. Suppose if you have done your MBBS or graduation outside Pakistan, then you will write there if you got the registration there. But it may be, for example, some doctors coming to the Bangladesh in maybe India or Pakistan after graduation from China. So they didn't register there. They only passed graduation. They came back to the native country and got the registration in the native country. So registration authority will be the native country authority. For example, in the Pakistan PMDC, right?
yes, that because that
Uh,
is the permanent registration. The
yes,
other
in
is
Bangladesh it will be BMDC like this. Maybe Indian is the Indian Medical Council, maybe,
right.
right? Then registration number. Everybody have a registration number in the registration. Clear. Date of full registration. What does it mean, Dr. Javed?
That one actually from PMDC I know, because the first time after, when you did your MBBS, you register with the PMDC. So they put the date. That is almost the same date immediately after.
Yes, yes, it is the same
So,
date. So it is the same question, registration authority, registration number, and the actually date of registration. If they said the full means they are confusing.
this helped me in fact, because I put both this Saudi as well as it's the PMDC. Then
No, no,
I
no, no, no. It is rarely that the authority will give you temporary registration. If any special situations are there, they give temporary registration. But already you passed to 2-3 years minimum to apply for the AKT exam. For example, in Bangladesh, minimum 5 years. So who will not having full registration in the meantime? So anyway, don't make complicated. Simply, this is the date of registration. That means when you got the license, this is registration.
initially started your
Yes,
registration.
it is not the MBBS certificate date. It is the date of the license.
Registration.
Yes, the eligibility you understood, in which you already know. Give a check mark there. Those who are not in the structured training, I know that about in Bangladesh, this one with a C. And
Me
there is a
also.
confusion.
Here, actually, first I was confused. I was put B and C, I was thinking. Then I didn't put B because the written structured 1 year training. So that must be structured training means in the family medicine.
So you
So
might not have. If you don't have, you will put the C.
I put C.
Yes,
But
but I'm
I
telling that in Bangladesh situation, if any colleague here, actually we don't have any structured training institute like this, A or B. So almost all Bangladeshi candidates should put C here.
yes, I think most of the people are putting C.
Maybe in the other country also. Maybe other country also. C, right? Uh,
Plus, because here I was confused because I has MCPS in family medicine my from my country,
yes,
Pakistan.
yes, yes.
From CPSP. So I thought that this is what they are asking, diploma in family medicine. So then 1 year structured training, that was confusing for me.
No, no. Is your MCPS is in family medicine?
Yes.
So you can put there also, doctor, is not it?
First I thought of
Diploma,
diploma in family medicine.
one
Yes.
year training program or diploma, 1 year diploma.
Yes.
So MCPS is equivalent to diploma.
Yes. MCPS is equivalent to diploma. Yes.
Yes. So if it is that one, other 2 years in, do you have the clinical experience?
Yes.
Yes. So you could put here
MC.
also B.
Yes.
You could
But I
put
put
here.
C. I thought maybe
Anyway,
they.
in the
But
both way, you are justified. Both way you are eligible, no doubt. Okay. But no need to give both. Only one is enough. If any point is satisfied, you put only one. Okay. Then 16.
16 is easy. The location where you want to take the exam. No? So I put Karachi.
Karachi. So other will give the check mark accordingly. I think
But
that's all up to this. Any other message for you here? Any extra information, Dr. Javed?
More thing, Dr.
Oh,
Usman, I want to add.
oh, I attach this. Oh, there is some thing also. I
More.
attach this
This is all.
documents, all thing,
uh,
and you will signature, full name, date, and this official use.